A community forum in Louisville is asking a tough question when someone is in a mental health crisis. Is there a better way than sending police? It comes after two recent LMPD officer-involved shootings involving people reportedly experiencing mental health emergencies. The discussion surrounded people from 7 county services, which is a mental health center here in Louisville, the Urban League, and LMPD.
We also have a number of people with mental health needs who don't reach out. And sometimes those individuals don't recognize that they have mental health needs, and police may be called to situations in which they're involved with.
We as a city should do better, and we should figure out how we do better and how we do right by our neighbors and those who may be suffering or on the brink of suffering. And how do we respond to them in a way that recognizes their humanity?
When someone is experiencing a mental health crisis, we all want the same outcome, right? We want the situation to be resolved where the people are safe. We want people to receive the help and the continued help that they need.
And panelists at the Louisville Forum, they focused on how officers handle crisis calls, as well as what resources are available and whether Louisville should expand non-police response options for certain mental health emergencies. LMPD says every officer receives 40 hours of crisis intervention, team training, de-escalation training, and they add that last year, through MetroSafe's partnership with 7 counties, more than 4,000 calls were diverted to crisis triage workers over the phone to get people the help that they need.